I am Dr. Sabahat Azim, Chairman of Glocal Healthcare Systems. So, if you look at globally the healthcare delivery circumstances, you have global giants which span continents and countries in pharmaceuticals and medical devices. But in healthcare delivery, you do not have a significant large player who commands pan-country-wise presence. So, healthcare delivery is actually fragmented. So, even today, at the end of the day, the delivery depends on the doctor, the person who's treating you. So, unless and until it becomes process driven, you actually really cannot standardize it. The kind of quality benchmarks that we have today, whether it is JCI, whether it is NABH in India, essentially at the end of the day, if you see, it's more of how you are doing a process rather than the process itself. We have not been able to assembly line it. So, once it is individual based between a person to person, you simply can't scale it up. You can't create the economies of scale, you can't systematize it, you can't processize it, you can't put it into a box, into a container and deliver it. So, it has remained fragmented. So, if you look globally, the largest healthcare chains still are only who are treating in millions, not even tens of millions, not hundreds of millions certainly, and not billions of people. So, you don't have a healthcare delivery which is, unless and until we are able to bring that, you can't bring costs down. So, first part is that it is human centric between a doctor and a patient. The second part is, unless you are able to bring the cost down, you simply cannot scale it up, because see, you can create a good private organization, you can create a business out of increasing prices, but to create an industry you need to lower the prices so that the scale can reach large number of people. So, the challenge in healthcare delivery is that we are still stuck in a position where we are using a painter to paint a picture rather than using a camera to make that picture. See, today, what do you imagine? You imagine that you will have medical colleges and nursing colleges, and these guys are going to study for 10 number of years, and they're going to be so good that they will know what is the right question to ask, what is the right investigation to do, and what should be done, and they'll be skilled enough, and this will all work perfectly. See, it's a chimera. It's not possible. Medical knowledge is not only vast, it's increasing by leaps and bounds on a daily basis. Governments mandated theories of continuing medical education, then saying, you need to retake a license every 5 years, keep learning. It's like, it's a bad solution, and we are trying to ram it down the throats of people. It's not going to happen. This world has a population of 8 billion people. You're going to say that with all our knowledge, which is today and which is going to keep on increasing, people will memorize and learn and understand so much, they will know what is the next step to be done. And this is in the age of technology, when your AI today is writing essays, is writing answer books, and you expect human doctors to do this. It is a misplaced notion. So the third leading cause of death after cancer and heart, cardiac cases, are hospitals. Now imagine, understand, this is the place where the per capita expenditure on healthcare is $9,000 to $11,000 per person per year, the highest per capita healthcare expenditure in the world. The penalty for making mistakes is huge because there's liability, there's huge insurances that you carry. You have the best people emigrating to US for better opportunities because the per capita expenditure is high, so salaries are also going to be high. These people can't be bad people. These people, the system, you can't say that, it's bad people doing bad work. And if this is the reality there, you cannot even imagine what is the reality in the rest of the world, in places like India and all. Now, this is not happening because these people are bad, they don't know what they're doing. It's a simple matter of the amount of data that is needed, the moment you can crunch it. So, if you break it down, these medical errors, they are into three parts. There are diagnostic errors, there are medication errors, and there are surgical errors broadly. So, what you need to be able to do is to separate two different parts. One is data and one is analytics. How do we get the best data and in real time basis at the cheapest cost possible? Second is how we can analyze that data to present it in a form that it is immediately available to the treating clinician or a person or a process whatsoever. Based on this, what has to be done? there's something called evidence-based medicine. It started from the 1990s with Cochrane trials, where we started saying that what part of medicine is really science, which means that there is evidence behind it, and what is by practice it is just accrued. So re-looking into that again and again. Now you merge these two things together, data science with evidence-based medicine, you have the inkling of a good solution that can create the footwork for let me say it, a process-based healthcare system. And that's where we need to go, because you cannot treat 8 billion people by just keep on increasing the number of people, producing more people, and then putting the load on each one of them. Because see, you may make 1 million doctors, you may make 10 million doctors. But for that person, when he's sitting in front of a patient, he has to consider all possibilities of, say, the 10,000 disease in ICD-10. The problem has not actually reduced. At that interaction, the problem remains the same. Unless you break that problem apart, you're saying, I'm going to penalize doctors, I'm going to say that this was criminal negligence, or this was, it's actually a simply bad idea. You're just playing. So what will happen is, people will be afraid to practice medicine, or the practice medicine cost will go up, doctors will carry heavy indemnities and insurances, or your whole system is going to fall apart. So we need to convert this into a process-based system, where you use data science, where you use analytics, you allow the doctors to focus on the human element, and apart from that, you need to process-base the actual delivery of the medicine, of surgeries and everything. Now, one part which I left was surgeries. There are some very interesting things that are happening globally. A pure commercial approach is not going to solve the problem, because you're not looking at the whole picture. What we need is to create a Toyota production system in healthcare. How do I find a process to diagnose people better by using the data sciences that are available today, the technologies in investigations which are point of care today, and the third part is how do I assembly line and process base the process, so that you're not going to solve 100% of the problem, but that there is no solution on earth that solves everything. What your target is, can I deliver healthcare to 95% of the people on earth at a price at which they can afford, at a quality which I can be fairly sure of that this minimum level would be delivered. That's the problem the world needs to look at. So what we have done is, we've had a long journey. It was a tough journey. Over the past 1 decade, we built the technology to deliver healthcare on the ground. Now, what we have already solved, we are able to deliver primary healthcare anywhere on the planet at a cost which is unbelievably low. For example, just to give you context, at 250 to 300 rupees, we deliver an entire episode of primary healthcare, including consultation, examination, investigation, and medication. We do this in the states of Orissa, Madhya Pradesh, Gujarat, Bengal, Bihar. We have our footsteps in Philippines, we have some footprint in Africa, we are looking at Mexico. But we need to actually partner, because if we want to do it alone, even with what we have done, and I think we have done a phenomenally good job and we continue to improve, accelerate, we need to partner with other organizations, with companies, with large employers, with organizations, to be able to spread it out, because we alone are not enough for a world of 8 billion people. So we are conscious of the fact that, yes, I think we took a decade to create these technologies. They work on scale. We do about 3 million people. To reach, even we have to think ourselves as even the business has to become assembly lined by partnerships and spreading it out. So that's where we are.